Well, there's so many things going on in the world, and we want to make sure that you stay connected to the things that really matter the most, and that's the things that's happening here locally. Medicare serves as the nation's healthcare program for individuals that are age 65 and older, and as well as those who meet specific eligibility criteria, I should say, at a younger age. Now, selecting the appropriate Medicare plan can be a complex task, given the often intricate language that's used in the plans and sometimes the numerous options that are available. Well, we got joining us now and sharing more and providing some insight is the Medicare Chief Distribution Officer at Cigna Healthcare Medicare, Gary Culp. And Gary, thank you so much for joining us and being with us today. And I want to talk about the Medicare enrollment period because it is coming up. And so break down for us the enrollment period and what is anticipated for Americans.
Daren, it's great to be here. Thanks for having me. And the annual enrollment period for Medicare is a really important time. It starts on October 15th and runs through December 7th. And the reason why it's important is because during that time, Medicare beneficiaries can take a look at what plans they're on today and what their needs are and whether they fit those needs or not, and look at an option for the upcoming year for 2024. So their selection right now during the October 15th through December 7th period gives them the opportunity for enrollment on December 1st for many options that are available.
Yeah. So we hear about Medicare Advantage Part C. What is Part C?
Great question. So, original Medicare covers a lot of benefits for in and outpatients, but it does leave some gaps in terms of coverage as well. And what's nice about the Medicare Advantage plans, or what some might call Medicare Part C, is that they cover everything that original Medicare offers and more. Things like transportation to and from a doctor's visit, dental coverage, which can help in overall wellness and health, vision, hearing, even fitness programs that keep people active, healthy, and well.
Gary, the question is, does it actually replace Medicare?
So, you never really truly replace Medicare, but the Medicare Advantage plan becomes your coverage. So as a Medicare beneficiary, when you elect a Medicare Advantage plan, that is your plan. So you don't, continue to have two separate plans of where there's Medicare, original Medicare and a Medicare Advantage plan. It becomes one. The nice thing about having it integrated, many of these plans offer prescription drugs as part of their integrated benefits. So not only do you get the health benefits and some of the extras that I kind of offered as well, but also prescription drug coverage.
Yeah. What are some of the common potholes we're finding during this time of year for people who are really trying to figure this all out?
Daren, for me, it's kind of like, thinking about what's important to you as the beneficiary. So for many folks, they have a relationship with their provider or their doctor. And so taking a look at the network that the Medicare Advantage plan has to offer is a really important consideration. So is my doctor in the network? Is the specialist that I'm seeing or potentially would like to see, is it in the network? Is an important question to have. The other is when you look at prescription drugs as an example, it's what drugs are covered and at what copay. And many plans like Cigna offer both retail pharmacies where beneficiaries can actually use their benefits and go into a retail pharmacy, as well as a mail order so it can be delivered directly to their home.
Yeah. And I know that you've been doing this for a minute. So when we talk about the Medicare Advantage plan, and particularly we talking about Part C, talk me about pros, cons, as people are trying to weigh it out right here. If I'm looking at the scorecard, how does this play out?
Sure. Well, the first thing I'd like to say is that, healthcare is very individual. So what might be really important for one may be different for another. And I'll use my own parents as an example. So, at one point in time, they were on two different plans because their needs were different. Their health status was different. What they needed in terms of access to specific doctors were different. So what I would say is that people really need to pause and take this time, the October 15th through December 7th annual enrollment period, to make a decision around what it is that's most important for them today and going into this next year, to make sure that the plan has the right fit for them in terms of what their needs are to stay healthy and active.
Well, Gary, I understand that you're using a full court press in order to get the message out. And one of those people who are taking part of full court press, NBA legend Magic Johnson, doing a little work with you. What's Magic been up to here?
Really exciting to have the partnership between Cigna and Magic Johnson. And, all of us know him as a pro in basketball, and just an amazing history in terms of his basketball career. What some don't know is that Mr. Johnson actually is an entrepreneur and focuses on helping, inner communities in terms of health and health access. And so having a relationship between Magic Johnson and Cigna has been really important in terms of sending the message. And, Magic will tell you that, he may be a pro on the court, but he's a rookie in terms of Medicare. And the reason why he says that is that Magic within about a year is going to be new to Medicare. And so right now he's looking at, what should I be considering? What's important? And making the same decisions that, folks right here are probably thinking about too, like what is important for me for next year in terms of the coverage that I'm looking at.
Yeah, and so having a voice like Magic Johnson has to be great because, kind of like bridges the gap for a lot of people who just might be in that in-between phase or just don't know. What advice do you have for those people? Because as I was sharing in the last segment, sometimes you're trying to weed through all this stuff, and it's like going through a Cheesecake Factory menu. You just don't know what to do, how to do it. But what advice do you have for people who may be just struggling in that area with the fog?
Well, kind of using your example at Cheesecake Factory, what I would say is that we don't want to make it complicated. We actually want to help you. And so think of us as kind of your server to help you navigate that menu. Cigna's here to help. We actually have resources available online at cignamedicareinformation.com. We also have a toll-free number where agents actually are online, where they can actually talk to individuals about what's important to them, what might be the right solution in terms of, addressing their health care for this upcoming year. And that's a toll-free number at 877-349-2897. And no different than Magic Johnson, many of us may be rookies in terms of Medicare, but that's where Cigna can help in terms of, making you a pro and comfortable in terms of what decisions you're making for this upcoming year.
Yeah. And that decision-making process is hard. I mean, obviously, for a lot of people, they just don't know how to navigate. But obviously, with the work that's going on at Cigna right now, really making people more comfortable, really making people more aware of what's going on, particularly with the Medicare Advantage Part C. Are you anticipating a lot of people going this way?
We are. Actually, what we've seen is over the last several years, an increase in individuals that have moved from, original Medicare to a Medicare Advantage plan. In fact, when you look at the total Medicare population, about 51%, so now a majority, are on a Medicare Advantage plan. And by no mistake, I mean, a Medicare Advantage plan may not be the one size fits all for everyone, but when you think of 51% of the Medicare population electing for a Medicare Advantage plan, there's some consistent themes as to why they're picking a Medicare Advantage plan. One is that they get all of the benefits that a original Medicare offers and more. And many of them are offered these plans with no additional premium. So it's not like people are adding a premium to be able to get these extras. But what I do encourage folks to do is take the time during this annual enrollment period, October 15th through December 7th, to really sit down and determine what is the right fit for me for this upcoming year, so that I can look at the network of doctors, look at the coverage in terms of prescription drug coverage, and then look at some of the added benefits to see which ones are most important for me in terms of dental, vision, hearing, fitness, and transportation as examples.
Yeah. And I know a lot of people, we were talking in my last segment, that are concerned pretty much with prescription drug costs. I mean, the rise in prescription drug costs. Talk to me about how Medicare is going to be able to help and assist in that manner.
Well, the nice thing is that when you look at programs like a Medicare Advantage plan, like what Cigna offers, many of them offer drugs and prescription drugs included in the actual plan. And so we help in terms of controlling those costs because we do them in copays and smaller amounts that make it more affordable so that people have access to their prescription drugs. And I'd mentioned earlier, but I think it's good to mention here around the prescription drugs too, is that we have it where you can go to a local pharmacy because some might have a relationship with their pharmacist or need something that's just a short-term medication. But we also offer delivery to your home. So we can send your medications, like the maintenance medications that you're taking on a regular basis, directly to your home. So you don't have to even go to a retail pharmacy if you don't want.
Yeah. Gary, as we're winding down, I really just want to get the opportunity to let you tell people what you feel they need to know, particularly at a time such as this.
Sure. So a couple of key takeaways. One is the annual enrollment period is the time you can make a change for the upcoming year. And it runs from October 15th through December 7th. So, take action in terms of, looking at what plan you're on today. Two, know that, healthcare is personal. So take the time to understand what it is that's important for you. And three, what I would say is contact Cigna. Let us help you. In addition to Medicare.gov, which is the Medicare site that will give you comparisons of plan options, we can actually help you in terms of navigating what may be a little confusing or complex and make it easier in terms of your selection. And the resources for that are CignaMedicare.com, and that's CIGNA Medicare.information.com, as well as a toll-free number with agents standing by at 877-349-2897.
Well, Gary, certainly a lot of helpful information has been disseminated out here. I want to thank you for taking the time and really educating our viewers as to what we need to know, particularly when it comes to Medicaid, Medicare Advantage Part C, and the great work that you guys are doing. Thank you so much for being with us.
Really appreciate it. Have a great day, and thanks for having me.
All righty, Gary. Take care now.